In our body, nothing happens by accident. Every single physiologic process is a tight orchestration of hormonal signals. Whether our heart beats faster or slower is tightly controlled by hormones. Whether we urinate a lot or a little is tightly controlled by hormones. Whether the calories we eat are burned as energy or stored as body fat is tightly controlled by hormones. So, the main problem of obesity is not the calories we eat, but how they are spent. And the main hormone we need to know about is insulin. Insulin is a fat-storing hormone. There's nothing wrong with that, that is simply its job. When we eat, insulin goes up, signaling the body to store some food energy as body fat. When we don't eat, then insulin goes down, signaling the body to burn this stored energy, body fat. Higher than usual insulin levels tell our body to store more food energy as body fat. Insulin levels are almost 20% higher in obese subjects, and these elevated levels are strongly correlated to important indicators, such as waist circumference and waist-hip ratio. But does high insulin cause obesity? The insulin causes obesity hypothesis is easily tested. If you give insulin to a random group of people, will they gain fat? The short answer is an emphatic yes. Patients who use insulin regularly and physicians who prescribe it already know the awful truth: the more insulin you give, the more obesity you get. Numerous studies have already demonstrated this fact. Insulin causes weight gain. In the landmark 1993 Diabetes Control and Complications trial, researchers compared a standard dose of insulin to a high dose designed to tightly control blood sugar in type 1 diabetic patients. Large insulin doses controlled blood sugar better, but what happened to their weight? Participants in the high-dose group gained, on average, approximately 9.8 pounds (4.5 kilograms) more than participants in the standard group. More than 30% of patients experienced major weight gain. Prior to the study, both groups were more or less equal in weight, with little obesity. The only difference between the groups was the amount of insulin administered. Insulin levels were increased, patients gained weight. Insulin causes obesity. As insulin goes up, the body weight goes up. The hypothalamus sends out hormonal signals to the body to gain weight. We become hungry, and we eat. If we deliberately restrict caloric intake, then our total energy expenditure will decrease. The result is still the same: weight gain. Once we understand that obesity is a hormonal imbalance, we can begin to treat it. If we believe that excess calories cause obesity, then the treatment is to reduce calories. But this method has been a complete failure. However, if too much insulin causes obesity, then it becomes clear that we need to lower insulin levels. The question is not how to balance calories, the question is how to balance our hormones, especially insulin. There are really only two ways that insulin increases. Either we eat more foods that stimulate insulin, or we eat the same insulin-stimulating foods, but more frequently. Obesity is not a one-cause problem. There may be many reasons why any given person is obese, and so the best way to address that is not to attempt to apply a one-size solution but to address the actual cause. Some people are obese because they really do just eat too much. However, many people eat too much because they are overweight, their hormones are storing too much of what they eat, or their hormones are prompting increase in hunger and therefore an increase in eating. Some people are obese because they are on certain medications that are known to cause weight gain, weight retention. So it isn't quite so simple to say that obesity is entirely hormonal versus caloric, but it is accurate to say that if you address the hormonal side, you will usually have positive results.